Many of us aspire to be as healthy as can be. What are some things that you can do to improve your health? Let's talk about how our lifestyle can affect our overall health and well being. Before we get started, let's take a brief look at the health status of adults in America. What do you think this stethoscope represents when we are looking at healthy habits? Yes, it represents preventive care. Unfortunately, only about 5% of adults in America are getting all of the recommended preventive services with the greatest potential for improving health. Yes, that means that 95% are not. This includes preventive services like blood pressure and cholesterol checks, screening for osteoporosis and several cancers, as well as vaccinations and more. Amanda Borski of the Agency for Healthcare Research and Quality indicates some of the commonly known reasons for not getting recommended preventive services include lack of health insurance, lack of a usual doctor or nurse, and problems with healthcare delivery, including wait times in clinics or doctor's offices. Adults should be proactive and ask their doctor or healthcare provider what preventive services are recommended for them based on their age, sex, and medical history. Think about preventive service that you have performed on your car. Our bodies are the same. We need to do basic things to keep our systems running well for a long time. The good news is that more than 20% of adults reported receiving more than 75% of recommended services, with some services faring better than others. The rate of blood pressure screening was close to 90%, for example. And there's more. About 1 in 4 American adults do not get their annual preventive checkup. That increases to about 2 in 4 of adults who are uninsured who do not get their annual preventive checkup. Sadly, that is 50%. And we all know what this represents: tobacco smoking. About 12% of the adults in the U.S. smoke. In Pennsylvania, about 14% of adults smoke, so we are a bit higher than the national average. The good news is that this has been going down since the Surgeon General's report on smoking was released in 1964. In fact, we have more than 10 million fewer smokers since 2000. Of course, some quit, and others weren't so lucky. Almost 13% of our high school students in the United States use tobacco products, and almost 7% of middle school students use tobacco products. The predominant tobacco product for our youth is by far e-cigarettes. Adding flavors to tobacco products can make them more appealing to our youth. The earlier that a person starts smoking, the more likely they are to become addicted. Nearly 9 out of 10 adult smokers tried their first cigarette by the age of 18. In addition, tobacco use during adolescence is commonly associated with the use of alcohol and other drugs, referred to as the gateway effect. While tobacco use among high school students has gone down, among middle school students, it has gone up. And how about this screen? Yes, this represents inactivity. About 47% of the adult population in the United States gets the recommended level of aerobic physical activity. That means that over half do not. When you combine muscle strengthening activity in addition to aerobic activity, about 24% of the population meets the guidelines. That means that 3 out of 4 people do not. So pretty much, if you are not meeting recommendations, you are in the majority. We will learn a little later this semester exactly what the recommended level of physical activity is. And my hope is that many of us will be on our way to moving more. And of course, this is proper nutrition. About 60% or more than half of the typical American diet comes from ultra-processed food. The more ultra-processed foods that Americans eat, the less protein, fiber, and vitamins they get, and the more added sugar, saturated fat, and carbohydrates they have in their diet. Ultra-processed foods take the place of minimally processed foods that deliver vital nutrients that keep us healthy. Don't get me wrong. I am not saying that you cannot occasionally indulge in your favorite treat. The key is occasionally. When ultra-processed food becomes the standard in your diet, you increase your risk for chronic disease. Alarmingly, we only get about 5% of our diet from fruits and vegetables or natural produce when you take out the white potatoes. You guessed it. This represents stress. 3 out of 4 adults report experiencing at least one stress symptom in the last month. 45% report lying awake at night. 36% report feeling nervous or anxious. 35% report irritability or anger. And 34% report fatigue due to stress. So where do our health habits leave us? Well, let's take a look at health in the United States. When we look at health statistics, we often look at life expectancy and causes of death. You are more than likely aware that our life expectancy has drastically increased in the last 50 years in the United States. In the 1800s, the life expectancy of Americans was less than 40 years and substantially lower for African Americans. The predominant causes of death during this time were malaria and tuberculosis for adults and measles, mumps, and whooping cough for children. Today, all of these diseases are preventable. An interesting fact, during the War of 1812, more soldiers died from disease than fighting. In 1900, life expectancy in the U.S. climbed to 46 for males and 48 for females, with the leading causes of death being influenza and pneumonia, tuberculosis, diarrhea, and enteritis. Not much progress was made before the 1900s. During the 20th century, however, the average lifespan in the United States increased by more than 30 years. By 1950, our life expectancy had risen to 66 for males and 71 for females, and continued to rise until 2014 when life expectancy reached 77 for males and 82 for females. Take a look at the causes of death from 1950 on. You see heart disease, cancer, stroke, and respiratory disease dominate the leading causes of death in the United States. So as public health initiatives expand, technology improves, and advances in medicine and medical procedures improve, life expectancy also grows. With these changes, we also saw a shift in the major causes of death and disability, from infectious disease to chronic disease or lifestyle disease. Chronic disease now accounts for 7 out of every 10 deaths in the United States. Positive lifestyle habits have the potential to help control premature death and disability and to improve health and well-being. Here's the breakdown. Cardiovascular disease and cancer account for 50% of our deaths in the country, many premature. As we saw, we are now dying of chronic diseases which are caused by our unhealthy lifestyles. There are many lifestyle diseases in the other 50% as well. Here are the 4 leading causes of chronic disease: poor diet, inactivity, excessive alcohol consumption, and tobacco use. These modifiable health determinants are the 4 most significant factors leading to chronic disease among Americans today. I understand you are young and chronic disease is a long way off. I would propose that beginning now is your best defense. In recent years, life expectancy in the United States has had its ups and downs. I mentioned earlier that life expectancy topped out in 2014 at 77 for males and 82 for females, giving us an average at almost 79 years for both males and females combined. Life expectancy then declined slightly each year until 2018, when it once again started to increase each year. While a few factors contributed to the drop between 2014 and 2017, the good news is that the reduction was offset by decreases in mortality for cancer, heart disease, and influenza and pneumonia, which could mean that we are slowly chipping away at chronic conditions and managing infectious disease. As you suspect, life expectancy took a hit in 2020. Between 2019 and 2020, we had a decrease of almost 2 years, mainly due to COVID-19. In 2020, heart disease and cancer remained the leading causes of death in the United States, and COVID-19 came in as the 3rd leading cause of death. This puts an infectious disease in the top 3 leading causes of death in the U.S. Since 2020, our life expectancy has started to increase steadily. The most current data we have is from 2022, where we are at an average life expectancy of 77.5 years in the United States. And the United Nations Population Division projects life expectancy to be 79.9 in 2024. We are making progress. However, we still rank fairly low when compared to other industrialized countries in the world. According to the United Nations Population Division, the life expectancy for Monaco in 2024 was projected to be 87, with Hong Kong and Japan following closely behind at 86 and 85. If you recall, I mentioned earlier that about 60% of the typical diet in the US comes from ultra-processed food. In Japan, it is considerably lower at about 38%. Could we be onto something here? We will dig deeper when we take a look at nutrition. Throughout this course, we will focus on how we can reduce our health risks and improve our overall well-being.